Alright, well, good morning, class. You have to bear with me if it's a little messed up. I'm going to talk about obesity in America. So, did you know over 65% of Americans are overweight or obese? Obesity in America is a huge problem. People are dying due to obesity, and it's very costly. Reducing obesity in America would alleviate many issues in society. And having people in my family that suffered from obesity and obesity-related illnesses, I'm qualified to tell you about the effects of obesity in America. So in this speech, I'll tell you about the obesity-related illnesses among American adults and children, the economic side of obesity, and the ways that we can reverse obesity in our country. So awareness of obesity in America is crucial to solving the problem. Today, millions of people in America suffer from obesity, which can cause a number of health consequences. In our country, more than 1/3 of adults are obese, and it has a lot of health risks with that. Like heart disease is the #1 cause of death in America today, which is an obesity-related disease illness. Also, sleep apnea. It's common among obese adults, which is a dangerous illness because the person stops breathing while they're sleeping. And also, according to the American Diabetes Association, type 2 diabetes accounts for 90% of the diabetes cases in America, which is easily preventable and can be regulated through diet and exercise. And also, approximately 12.5 million children are obese in America, a number that has tripled since 1980. And the Assistant Secretary for Planning and Evaluation states that childhood obesity is caused by a lack of exercise and unhealthy eating habits. That is increased portion size, sugar drinks, more fast food, all the companies targeting bad food to kids. Just like all the cereal we were talking about. And then the health risks for children include type 2 diabetes, asthma, and higher risks for cardiovascular disease or CVD. And childhood obesity can also cause social and psychological problems, including poor self-esteem, discrimination according to the American Academy of Child and Adolescent Psychiatry. So that's a little bit about that. The health-related illness caused by obesity also create an economic problem in the United States. So obesity in America also affects the economy through healthcare and the food industry. An obese person will spend approximately $10,000 more than a non-obese person in healthcare costs, as we kind of saw in the previous. Obesity adds approximately $190 billion to the annual healthcare costs in the U.S. And Rick Unger wrote an article that says that the Affordable Care Act allows employers to charge employees 30 to 50% more than their contribution to their health insurance benefit if an employee refuses to participate in qualified weight loss programs. The food industry largely contributes to obesity in America through advertising and purchasing products. I'm sure we all agree upon that. And also, food advertising is $10 to $12 billion industry annually. And I don't know if you've ever done advertising for a company, but it adds up. Increased consumption of processed foods, such as fast food, correlates with an increase in obese population. So, by looking at the economic side of obesity in America, it is easy to see that a solution is needed for the nationwide weight problem. Lowering the amount of obese people in America is very important to the health of our country, both physically and economically. Measures of prevention such as education of diet and exercise can reduce the initial problem of obesity in America. Regular physical activity in both children and adults is one way to prevent obesity and lower the current rates of obesity. In addition, eating a well-balanced diet of appropriate portions can also sustain a healthy lifestyle. And an incentive provided by the government can help reduce obesity in our government. Government funding for school lunch programs is important because it provides low-income students with healthy meals, which will hopefully lower childhood obesity over time. That's the hope, but we'll see how it goes. So, in conclusion, the increased awareness of the facts about obesity in America can begin to reverse the trend in weight gain in the U.S. So today in my speech, I talked about the health concerns relating to obesity in both children and adults, the economic side of obesity in America, and the reduction and prevention of obesity in the country. So I hope that you learned some interesting facts about obesity in America. And in the words of Albert Einstein, the problems cannot be solved at the same level of awareness that created them. Thank you.